Welcome to the Attention Deficit Disorder Expert Podcast Series by Attitude Magazine.
Hello, everyone, and we're glad you can attend Attitude's weekly ADHD Experts webinar. We do hope that everyone is staying safe and staying well. This is a follow-up to the Feb 26th webinar, Marijuana and the ADHD Brain, How to Identify and Treat Cannabis Use Disorder in Teens and Young Adults. Just some housekeeping before we get started. If you've listened to one of our webinars before, you know we offer attendees a certificate of attendance. When the webinar ends, a post-event survey will pop up. It will list 3 questions about the quality of the webinar, followed by 3 questions titled, Required for Certificate. If you would like a certificate of attendance emailed to you, you should answer those 3 questions. If you don't want a certificate, well then, don't bother. When Dr. Olivardia did his webinar about marijuana and the ADHD brain several weeks back, there were so many questions from attendees that Attitude decided to do a part 2, a follow-up, so we could address many of the questions that were unanswered in the first webinar. Just to a main headline of the first webinar, cannabis use affects many things negatively: memory, motivation, attentional focus, processing, learning, performing complicated tasks with many executive steps, balance, posture, coordination, and even reaction time. So it affects a lot of things in a person's life. Just to remind you, Dr. Olivardia is a clinical psychologist and lecturer in psychology in the Department of Psychiatry at Harvard Medical School. He maintains a private psychotherapy practice in Lexington, Massachusetts, where he specializes in the treatment of ADHD, obsessive-compulsive disorder, and body dysmorphic disorder, and eating disorders. You can ask questions of Dr. Olivardia as he gives us answers to the ones listed on the slides. You might have more questions as a result of all this. If you want to download those questions for some reason, click the drop-down menu labeled Event Resources on the bottom left of your screen. If you do not see the Event Resources tab, you need to refresh the page. So with all of that, I'm going to let Roberto take it over, Dr. Olivardia. We will go straight to the questions listed on the slides.
Great. Well, thank you. And thank you, everyone, for attending this webinar. And similarly, express that I hope that everyone is staying safe and healthy during this time. And given this time, actually, before I go to the questions, just to sort of add a note, given that we're in this situation with COVID-19, that if there's any time to quit smoking marijuana, vaping, smoking, or quitting cigarette smoking, it's actually now. There have been studies even prior to this that have shown that marijuana smoke significantly aggravates staphylococcal infection by blocking immune functioning. THC decreases immune functioning in your lungs. It increases mortality in experimental animals. In the case of viral infection, animals given THC after exposure to things like the flu exhibit decreased immune cell functioning and substantially increased viral loads, specifically in their lungs. A study actually found a Chinese study that smokers were 14 times more at risk for severe coronavirus infection and 14% more likely to get pneumonia for it. So there's likely more data that's going to come in regarding the correlation of, we know with cigarette smoking, but also with marijuana and with vaping. And I wouldn't be surprised if we find that a portion of the young people that we're seeing, who initially we thought that COVID-19 didn't sort of impact young people without pre-existing medical conditions, but we're starting to see that more. And I can't help but wonder whether there's a correlation with things like vaping and with smoking marijuana, as well as cigarettes, that make people more susceptible to it. So I just wanted to put that out there, given this real surreal situation that we're all in, to let people know that if you are smoking you're putting yourself at more risk. So I'll start with the questions that we had from last time. So in a few sentences, how can we explain these risks to users of cannabis who have ADHD? How do we explain the dangers of cannabis use in simpler language? So basically, if we were to say in a couple sentences, I would say even though it is seen as safe, cannabis is not for anyone younger than 25. I'm certainly not promoting it for people over the age of 25, but a lot of the research that we see in terms of major neurological impact is for people under the age of 25. This is not a moral issue. Strong neurological research demonstrates that it is an assault to the brain and can interfere with every aspect of brain functioning, and you will be limiting yourself by using cannabis. That's how I would describe it basically in a couple sentences. And then within that, one can sort of expand more in talking about the various neurological findings that we find. Again, pushing away this idea that you're bad or good smoking cannabis, that is not the issue here, that we're really looking at this as a medical scientific issue. Why do kids and teens self-medicate with cannabis? Is it because it is effective at remediating their symptoms, or is it because cannabis is the most readily available substance? It's a great question. So cannabis is appealing to an ADHD brain. So people, especially people with ADHD, will report that they focus better, they sleep better, their mood is more calm, they're less bored, things are made more fun, it can slow down racing thoughts, and all of those things are true. So it's not that people are inaccurate about those subjective experiences. It is very accessible, which makes it definitely something that becomes readily available to people. Many people have peers who are also using it, particularly a lot of the young people I work with who have ADHD. So it has more of this sense of normalization. It is, because it's legal in many places, it is almost kind of sanctioned in a way without people really understanding the risks, and is often marketed as being medicinal for ADHD. It is not medicinal for ADHD. Just because it does achieve those effects of making people focus more, have a calmer mood and whatnot, does not mean that it is without harm or damage to the brain. In the same way that we could say that alcohol can be used as a way of calming people down. A pint of Ben & Jerry's ice cream could be used to calm people down, but we wouldn't prescribe that for someone to have a pint of Ben & Jerry's ice cream every day that they have a stressful day. So just because something has an impact, a positive impact, in terms of subjective symptoms does not mean that it's healthy or medicinal. And that's what's been lost in the conversation with cannabis, is that this word medicinal gets thrown around because people are saying, hey, I'm sleeping better using this. Yes, I'm sure you are, but that doesn't mean that there isn't a real substantial neurological impact. What information do you have regarding stimulant use in combination with cannabis? Can cannabis help with symptoms after stimulant medication wears off? So what we know is that methylphenidate, which is an ADHD medication, there's been some research studies that have looked at methylphenidate and its interactions with people who smoke marijuana. And the results show that the two substances actually interact pretty significantly in that they can cause increased strain on the heart. So there are cardiovascular effects actually when people are using marijuana and a stimulant. They really should not be interacted with. There are some studies that show that the use of cannabis can decrease the effect of a stimulant medication. So if somebody is trying to treat their ADHD, taking a stimulant and using cannabis, that they're actually putting themselves at a disadvantage because the cannabis is impacting them negatively and their medication may not be as effective. So it's actually not good for them. Regular use of cannabis also can make it very difficult for the client as well as the prescriber to differentiate between symptoms of, is this an ongoing sort of hangover? Is this depression that's unrelated to marijuana use? Is this the waning efficacy of a prescribed stimulant? It makes it just much harder for anyone to know how well your stimulant might be working or how much more or less to prescribe when you're using another substance. And that's true for other substances as well. If somebody is drinking a lot of alcohol or using nicotine, that it makes it difficult because there are interaction effects that happen with medication. And so sometimes you could be increasing a dosage because somebody's saying, oh, I'm not seeing any efficacy from this medication, and a prescriber might increase the dosage, but that increase of dosage interacting with whatever substance you're taking may actually have harmful negative effects. There's no evidence that cannabis is useful when stimulants wear off. So there isn't any data that supports that, and there haven't been studies that are specifically looked at that either. But again, what we know is that cannabis is not medicinal for ADHD, so there wouldn't be any reason to think that it would be a useful thing when a stimulant does wear off. What is the difference between cannabis and CBD oil? Can CBD oil help teens stop using cannabis? So I didn't go too much into it in the last webinar, but we have more time in this one. So CBD stands for cannabidiol. It's the second most prevalent of the active ingredients of cannabis or marijuana. Now, CBD is seen as an essential component of medical marijuana. It's derived directly from the hemp plant, which is a cousin of the marijuana plant. And even though it's a component of marijuana, by itself, it does not cause a high. It doesn't have the same psychoactive properties as THC does. According to the World Health Organization, quote, in humans, CBD exhibits no effects indicative of any abuse or dependence potential. To date, there's no evidence of public health-related problems associated with the use of pure CBD, and I'll talk about why that word's important. It's been touted to be used in a variety of health issues. The strongest scientific evidence, however, has been in the effectiveness of some forms of childhood epilepsy and epileptic syndromes, which typically might not respond to a lot of the anti-seizure medications. And in those studies, CBD has been found to reduce the number of seizures, and in some cases, it was able to stop them altogether. There are some studies that in animal models find that CBD applied to the skin may help lower inflammation due to arthritis. So there are more studies in the area of sports medicine that are starting to look at that, how CBD can be helpful in inflammatory or neuropathic pain or types of chronic pain. But there's still more studies that need to be done on that. There are side effects, though, of CBD that can include nausea, fatigue, irritability. It can increase the level of your blood if you're taking certain blood thinners. It can raise levels of certain other medications in your blood by the same mechanism, that other substances might. But what's important is that a very important safety concern with CBD is it's primarily marketed and sold as a supplement, not as a medication. And the Food and Drug Administration does not regulate the safety or purity of dietary supplements. So you can't know for sure that the product you're buying has actually those active ingredients and the dose listed on the label. And the product may contain other elements that are unknown elements. So we don't really know also what an effective therapeutic dose of CBD is for any particular medical condition. So we don't have high quality evidence in human studies that really show or can pinpoint even effective doses. And because of that, you have to think of it as an unregulated supplement. So it's difficult also to know exactly what you're getting. So when I said, the word pure CBD earlier, what some studies have actually shown is that when quote unquote pure CBD has been actually tested, it's been found actually to have trace amounts or more than trace amounts of THC in it. And so sometimes it's not pure, it's actually more of a hybrid version of CBD and THC. So it's more than what's actually advertised. And so I always tell people, buyer beware. The jury's still out. There are some, again, preliminary studies, certainly, again, with epileptic syndromes and whatnot, and the amount is, seen as very low. There are no studies, no empirically valid studies that have shown that CBD can be helpful for ADHD at all. Now, that doesn't mean it might not be, but we just don't have studies that really support that claim. And I can definitely tell you that CBD, I mean, I was in the city a couple months ago, and there was a store that advertised CBD can help, you know, and it listed all of these things, including OCD, or obsessive compulsive disorder. And I can absolutely tell you that CBD does nothing for OCD. So that to me is just blatant false advertising. CBD is not this magic, you know, oil or wonder drug that's going to cure everything. But are there things perhaps that can help? Perhaps. The jury is still out. What are the effects of cannabis use on the ADHD brain, and how long do the effects last? Does cannabis exacerbate ADHD symptoms? Absolutely. And if you know, people can, in referring to the last part one of this webinar, I go into definitely a lot more detail. As Wayne had mentioned at the top of this, that there's substantial research on the neurological impact of cannabis, particularly for a developing brain, and it's not good. That it can affect your short-term and long-term motivation, your memory functioning, your ability to attend, processing, learning, taking on new tasks, breaking down complicated tasks into executive steps, balance, posture, reaction time, motor coordination. It can dysregulate your appetite, your time perception, driving ability, blunted affect. It can reduce impulse control. So all of the things I mentioned, you know, especially for people with ADHD, are issues to begin with. So now you're putting a substance that actually is just going to exacerbate those issues. It is definitely not good for the ADHD brain. It's not good for the developing brain, and it's especially not good for the developing ADHD brain. Cannabis absolutely exacerbates ADHD symptoms. However, it does it in a very tricky way, because the short term, as I mentioned, is that people will report an improvement in symptoms. I'm sleeping better, I'm focusing better because I got a good night's sleep yesterday. So the short-term effects people are reporting as positive. However, what we know from, again, neurological data that looks at what's happening in the brain is the long-term impact is not good. And with chronic use, especially if someone starts young, it can have irreversible neurological effects on the brain. So that's what makes it very tricky, is that people are getting almost a short-term reward from it and saying, hey, this feels good, like how could this thing, you know, be bad? But yet it's kind of slowly, basically disintegrating neuronal connections in the brain. So the effects also of THC, the chemical in marijuana that makes people feel high, can stay in the body for several days or weeks. So studies have shown, as I think I mentioned in the last webinar, that if somebody smoked marijuana on a Monday, that even if they were given a task, a reaction time task or driving task on the Tuesday, that they will still have an impairment from the marijuana that they smoked the day before. So it still stays in your system. So sometimes when I have a patient that said, oh, I'm totally fine to drive, I haven't smoked in a day or two, that's not necessarily the case. That actually studies show it lingers in the brain. I was once, the last time I was traveling, I was taking an Uber and I went into the Uber car that reeked of marijuana, and I immediately I said, oh, I'm sorry, I'm going to step out of the car, and the guy was offended by it. But to me, I think we have to understand that I don't differentiate somebody who is smoking weed driving a car and somebody who is drinking alcohol. I felt like I was still at risk. And so I offended the Uber driver, but I'm not going to be having somebody drive who, is clearly smoking a lot of cannabis. What course of action do we suggest for parents when they find their child's stash of weed? What steps should be taken, and how should you approach your child who already has a tendency to lie and overreact? I'm sorry, just going back to the first question of how long do the effects last, just to tell you a little bit more about that. The length of time can actually vary. So as I mentioned, it can last for several days or weeks, but it typically will depend on a number of factors. One is how much body fat the person has, how often do they consume the drug, how much they smoke of it, or taking as edibles, and then when they do drug testing, how sensitive also the drug test is, because some drug tests, only pick up on a certain number of days. Drugs such as alcohol, for example, can completely disappear from the body in just a few hours, but weed and cannabis will linger and take much longer. Drug tests can detect THC in urine, in blood, and in hair for many days after use. Saliva tests can only detect THC for probably like a few hours. That's because of the way the body metabolizes THC. THC is a lipid-soluble chemical. That means it binds to fat in the body, which increases the length of time it takes for somebody to eliminate it completely. So urine tests can detect it for approximately 3 to 30 days after use. Saliva tests, again, usually a few hours, but at most probably about a day after. Some saliva tests can detect it up to 72 hours. Hair tests are probably the most sensitive. They can detect THC for up to 90 days after use. However, these tests are testing the oil in skin that transfers to the hair, and so they may occasionally show as a false positive. So a person who comes in contact with the THC user could theoretically test positive on a hair test. Blood tests can only detect THC for about 3 to 4 hours. So I just wanted to sort of get that out there. So going back to the question of what course of action do parents take? So first is I often recommend, even though any parent is going to have a gut reaction, when they discover that their child has a stash of cannabis, is first, before you sort of react, is educate yourself and in a sense go through the range of emotions before talking to your child. So seek consultation with their doctor or pediatrician, with a therapist who has experience in substance abuse, in terms of talking out, first of all, your own feelings and reactions about it, because you want to go in to this dialogue or this discussion in a controlled, calm way. It will not go well if you're yelling and screaming and saying all of these things that later you might regret. And given that most of us who have ADHD children, it's because maybe we ourselves have ADHD that we can be impulsive as well, and that includes with our emotions. So we want to make sure we get our emotions in check, but also get educated about what cannabis is and how it can be appealing, and try to almost see proactively what your child might be experiencing that has them even find this substance appealing. When you do start the conversation, remind them that you love them, that you care for their well-being, that this is what this is all about, is that I care so much for you, and I want you to be a healthy person, and I found cannabis in your room, and I'm concerned because I know that this is not healthy. And so what I want, as I mentioned earlier, what we don't want to say is, how can you do this? I taught you better. You're a bad person. Don't you know better? And I know you'll be feeling those things, and and that's okay. And that's why you should talk that out with someone else to kind of get that out. But that is just going to shame your kid. It's going to shut them down. They now see you as the other and the enemy, and is not somebody who's going to collaborate with them. And I would emphasize, this is not a moral issue, that this really comes down to science. Also, as a parent, for yourself, is to know if this does not mean that you have failed your children or that you have done a bad job parenting them because they're smoking marijuana. Unfortunately, or fortunately, depending on how we see it, we don't have 100% control over our kids, especially when they're out in the world with peers and their own culture. So you definitely have to sort of come to terms with that too, because I think a lot of times parents come from that place and they're feeling almost like personally bad and dealing with those feelings as well. I would ask your child, and again, calm way, I found this and I'm concerned, but I'd like to know what's the appeal of this for you? What does this do for you? The first time you tried it, how did you feel about it? And ask them about that. And sometimes actually when I've recommended this to parents, because I've done these consultations with parents to set up these conversations, and they'll come back and they'll be like, the teens sometimes are almost like, whoa, like they're almost shocked that the parent isn't yelling and screaming and punishing them right away, that they actually said, what does this do for you? Tell me, how did you feel the very first time that you did this? Because we do, our kids aren't doing this because they're bad. Again, the addiction gets such a terrible stigma around character and morality, and lots of very, very good people are addicted to substances or experiment with substances. And so we want to sort of disentangle that. I would also be clear, though, that the family's rules is that drugs and alcohol are off limits. So you are setting boundaries, that it's not only illegal for minors especially, but it's very harmful. You do want to set up consequences for it. So even though you're engaging with them in a conversation, you're also letting them know this is not acceptable, and that you are a parent, you are setting boundaries in the house, and that there are specific expectations that you have. And it may be that that you set up certain boundaries, but one of the things you want to move away from is this idea of trust. Like sometimes parents will say, you have to come home directly after school for 2 weeks, until we can trust you again. And like that phrasing, again, it really is, it shames kids a lot, and it makes them feel just really bad. And now they almost take the stance of, well, if you're not going to trust me anyway, I might as well keep doing it. I always phrase it and would recommend that people phrase it as like this: a substance like this can be bigger than you, in the sense that simple experimentation could turn into something more pretty quickly. And if they have ADHD, to let them know that they are at higher risk for addiction. I would share with them if there is a family history of addiction, now is the time to share that with them if they don't already know. If someone in your family, they don't have to know specifically who, but you can say, we have members of our family who have struggled, and maybe they've struggled with alcohol or some other drug, but it's all substances. You don't want to spend too much time lecturing them, and you can say, look, maybe we can watch a YouTube video together. Maybe it could be a webinar, like part 1 of this webinar that you can watch together. You can tell them, addiction does have a genetic component to it, and it's important, again, to share that with them. If you yourself, had an issue or can see those addictive tendencies in yourself, whether or not you actually experimented or used, it could be helpful to share that with them and say, look, as someone with ADHD, I have myself a very addictive personality. And so I can understand it. I can understand that if something feels really good to your brain or to you, you're going to want to keep doing it. And that's like the ADD way, except there are going to be good things that are that way, and these are not so good things. You want to assure your child you're not going to enable their use. And this is a very tricky thing, because sometimes parents will say, well, I'd rather my kid be smoking in the house than be smoking in the neighborhood or with somebody else. And I don't subscribe to that, because I think what happens is, number one, it doesn't stop them from smoking or using anywhere else. What it does is have them feel that there's some level of, of permission, basically, to do it. So it might mean hard times are coming your way if they refuse to comply to these rules. And, with any kind of, and I often use that as data, an indicator as well, that, it's almost like the more strongly they oppose those kind of rules, then that's an indicator to you that this is going to be a difficult thing for them to grapple with, meaning that they like the substance that much that they're willing to dig their heels and have so much family conflict around it. Sometimes kids might be like, oh my gosh, you're making such a big deal out of it, fine. And I've seen that happen. But with some of the teens that I've worked with they get rageful at the idea of these boundaries and really push those limits by, smoking or using edibles in the house, even though they've been specifically told, not to. So that's it's very, very important. And kids and teens, young people will lie. And I think part of it is also to get educated about just, signs and of when somebody is high, which is, it varies between people. And, sometimes it's very hard to tell, depending on, personality, but your child best. And so if you, think that they're acting strange and they're like, no, I'm fine, it's okay to say, I don't know, part of me wants to believe that, and part of me knows that a substance like this, like any substance, can have people not always be truthful. That's very different than saying, I can't trust you, you're a liar. It's basically putting it and couching it in the frame of how much of a grip a substance like this can have on them. And for people who are regular users, there are parents who do drug testing and home testing, either they themselves or through, their child's physician, in terms of, making sure that they're not using. So next question, isn't cannabis a natural treatment since it's just a plant, unlike prescription medication? It is, just because something is a natural substance doesn't mean it's a natural treatment. It's not, we cannot draw equivalence. Tobacco is a natural substance. We can all hopefully agree that tobacco is not a treatment for anything, and in fact is responsible for the deaths of thousands of people, tens of thousands of people every year. So it's just because something's natural, and just because something is unnatural in the sense of prescription medication doesn't mean that it can't be a useful, effective treatment. As we see with the multitude of prescription medications and vaccines and available medical technologies that we have that are made in labs but have saved countless number of lives. Now, don't get me wrong, I know that prescription medications have side effects. I know that they're not always easily tolerated. And that's, between a person and their doctor to really figure out what's the right treatment for them. But to keep in mind that, you're always trying to reduce harm in any of these situations. And so when I have a patient who's taking, let's say, a mood stabilizer, for, let's say, bipolar disorder, that might cause weight gain, that might have, certain medical side effects. But if the alternative is not taking that medication and, killing themselves, then they work at taking the medication and finding ways to, manage those side effects. But the goal of the medication is to basically almost kind of neurologically keep the brain grounded. It is not to actually almost unwire and unground the brain. And that's what that's what cannabis does. So again, if people are using it and it can feel like a natural treatment, but what we absolutely know from looking at brain scans and what happens to neurons and dendrites, which are like these tree-like sort of messengers in the brain, is it's limiting, it's impacting it in a very negative way in the long term. Treatment should not be doing that. Treatment should be grounding or not making something worse or actually improving it. And cannabis does not do that. Cannabis actually contributes to the further impairment of the brain. Does frequent or chronic cannabis use by adolescents increase the likelihood or intensity of rebellious behavior, including symptoms of oppositional defiant disorder? I would say that rebellious behavior is likely due to issues that might underlie the cannabis dependence, in the sense that if somebody is feeling anxious, if they're depressed, their ADHD symptoms, that they're feeling, a lot of people self-medicate with cannabis. And so a lot of times that oppositional behavior is really their anxiety that they might be dealing with, or depression, or agitation, other symptoms that almost kind of just boil over in some ways when they don't have any way of dealing with it or have active coping skills or mechanisms. And then sometimes they might act out in a lot of different ways. Without a doubt, addiction brings rebellious behavior in service of the addiction. There are lots of people who struggle with addiction who have never been oppositional or defiant, who would never steal or lie or things like that. But when you are in the throes of an addiction, your value system goes out the window. And again, this is not because you're a bad person, but because this is what addiction does to people. So I, have treated people in my life who are good people who, when they need money for drugs, they will steal, they will sell their bodies, they will do things that they otherwise would never do. They will be physically aggressive to a parent who is telling them that they can't smoke weed in the house. So yes, you might see those behaviors, but I don't see it as creating oppositional defiant disorder as its own diagnosis as much as I see it as sort of an effect of underlying anxiety, depression, ADHD symptoms that are not being treated or the person is not adequately coping with, as well as when addiction is in its throes, this is what happened. Cannabis can dampen executive controls, as I mentioned, as well as emotion regulation, which is an executive function. So one's ability to control their emotions, to guide their behavior in service of their emotions in terms of long-term goals is going to be impaired by marijuana use. So yes, to answer your question, that more chronic marijuana use will create a more emotionally dysregulated person and somebody who is now in service is trying to do everything they can to get their hands on a substance that they feel that they very desperately need. And as I mentioned last time, 18% of young people who use cannabis are addicted to it. Not psychologically addicted. I mean, well, they can be psychological, but not just psychologically addicted, but physically addicted. It's a myth that you cannot be addicted to cannabis. My son has autism spectrum disorder and ADHD. I have considered THC for calming him, and I have read accounts from parents of children on the spectrum who have had good success using it rather than antipsychotics and or stimulants, which have a huge list of side effects. Could cannabis be a helpful option for individuals with autism and or ADHD? It's a good question. Now, right now, there are no placebo-controlled double-blind studies, which are the strongest methodological way that we do studies. And what that would mean is you have a group of people, let's say, who have autism spectrum and ADHD, you have a control group, and then you divide the groups, and you give like half, let's say, of the autism ADHD group the actual substance and the other half a placebo, but neither they nor the experimenter knows who has what. And then when the blind is broken, you see what the results are. There have been, however, case reports that find that in individual cases, it can help relieve some of the symptoms, particularly around behavioral outbreaks and major sort of like tantrums or meltdowns. But however, there are those same case reports that find that in people with autism spectrum and ADHD, it can increase restlessness, sleepiness, irritability, and loss of appetite. So it's, again, that sort of balance. Many trials, though, that have looked at this, and these case studies or case reports, use CBD with about 1% to 2% of THC, which is low compared to like a typical joint nowadays could have the minimum 12% THC. So we're not talking about smoking a joint. That these studies are not even showing like high levels of THC. It's showing CBD with very low levels of THC. But honestly, there's insufficient evidence right now to see whether it could be causing harm. And so it's a lot we still have to weigh on. I would definitely talk to your doctor about it. It doesn't mean that there can't be some way, perhaps, that with CBD or maybe low levels of THC, but the evidence doesn't show right now that at least in group settings that we're finding these significant differences. or again, whether it could on the long term cause harm. So just like I was mentioning before, we may see these symptoms decrease in the moment, but is this causing or setting the person up for more emotional dysregulation later on? We don't exactly know. Kids with ADHD are attracted to cannabis because it seems to calm their brain. Is there anything that they can take legally that would produce a similar effect? That's a really good question. And a lot of times, we know that stimulant medication can be helpful for some people. Some people don't respond well to it or don't get that same feeling from it. But that's pretty much what stimulants are designed to do for an ADHD brain, not for a non-ADHD brain, but for an ADHD brain, is to give at least a feeling of like groundedness and a person's ability to feel kind of more connected in their body and to calm their brain, not in the way perhaps that marijuana is, but to calm their brain in the sense that they feel that their thoughts are more fluid, more cohesive, that they're able to sort of focus on one thing, and in that way, there's not as much noise in their brain. Now, other than medication, behavioral things have been shown to be promising. Exercise actually is wonderful for everybody, but especially for an ADHD brain. There's a lot of studies that show particularly high aerobic or high intensity interval exercise that gets the heart rate going, but also pumps the brain with a lot of really good neurochemistry, including dopamine and endorphins, that can really help pump executive controls. I remember anecdotally in college that I discovered accidentally that after I would work out, I'd come back to my dorm, and I would suddenly find myself almost ready to write a paper that I had been putting off. And so that's what I would do. Anytime I had to write a long paper or do an assignment, I'd go to the gym, have, really like sweat it out, come back, take a quick shower, and I literally just almost like launch right into that task. And then just general health habits, good sleep and nutrition. Now, all of these things, in and of themselves require a certain level of executive function, and they're not magic bullets. And it's hard for a lot of people to hear that because they're like, well, that doesn't help me in the moment. Well, that's true, but these are things that we know help with executive function and help with calming the brain. Mindfulness, meditation, very, very helpful. And in the ADHD community, a colleague and friend of mine, Dr. Mark Burton, I would recommend you Googling him. He does a lot of work in the area of mindfulness and a lot of great work that shows how helpful it can be in creating that calm. But also keep in mind that when we're talking about a substance, and this is true for any substance, I often will say to people, we might not find anything that exactly does to your brain what cannabis does. Because if we tell people, oh no, we will find something that does exactly what it is, and we don't, it's just going to say to the person, oh great, But the problem is with any addictive substance, most natural things might not feel exactly that way. That's why the person is seeking the unnatural thing. However, if we can find something that gets you to a place enough that you don't have to use the substance, and that's what we're trying to aim for. How do different types of cannabis and frequency of use affect the growing brain differently? Well, every brain is different with different predispositions and vulnerabilities. So frequency for one is different than frequency for another. Dopamine response, addiction potential differs amongst people. Generally, the more frequent that people will use cannabis, the worse it will be for the brain of that person. But we can't compare between people, and peers do this a lot. Someone might say, oh, well, so-and-so smokes twice as much as I do, and he's fine. Well, so-and-so's brain might be, maybe he doesn't have the same genetic predispositions. Maybe that person weighs more than you do. Maybe they're using a lower THC. Who knows? I mean, we know that lots of people can drink alcohol, have a glass of wine, and some people, that one glass will turn into 10. So I always tell patients you can't compare because you're assuming that there's an equivalence in your brain, and there isn't. Now, with cannabis, there's what they call the indica strain and the sativa strain are the two very common ones. Indica is seen as more relaxing effects, sativa more energizing effects. However, when tested, that studies actually show that most of the strains that purport to be one or the other tend to be a hybrid. And so there are some indica strains that have actually been shown to be more energizing and some sativa strains, which actually create more fatiguing effects. So we don't really know these different strains. They're coming from different parts of the world, the quality of them. So sometimes when people are like, oh, well, I just do the indica strain, which is more relaxing and isn't as bad as the sativa strain. Well, we don't 100% know that. And again, the data doesn't necessarily show that the indica strain is less neurologically impactful than the sativa strain. And also keeping in mind, there are other oils of the cannabis plant that might give it particular smells and can play an important role in cannabis, the psychoactive effects of cannabis. There's oils known as terpenes, and that can also vary between people. Can kids be harmed by secondhand smoke if their parents smoke cannabis? This was actually a great question that somebody asked in the first webinar, and I wasn't 100% sure. And I looked into the data from that, and yes, the answer is kids can, in fact, be harmed, and not just kids. Anyone could be harmed by secondhand smoke if someone around them is exposed to secondhand smoke. So secondhand smoke from combusted marijuana can be breathed deeply into the lungs. It can cause lung irritation, asthma attacks. It can make respiratory infections more likely. So again, given the situation we're in now with COVID-19, that know that you're putting yourself at higher risk and you're putting people that are exposed to marijuana smoke or cigarette smoke around you also at higher risk. That studies show that there are significant amounts of mercury, nickel, of lead, and other chemicals, 3 times the amount of ammonia can be found in mainstream marijuana smoke than even is present in tobacco smoke, and that can be ingested secondhand. Secondhand marijuana exposure can also impair blood vessel function. Studies that have seen this in rats that find that marijuana smoke exposure had greater and long-lasting effect on blood vessel function than even exposure to secondhand tobacco smoke. One study I came across found that 1 minute of exposure to marijuana secondhand smoke substantially impaired endothelial functioning, so like lung cell functioning in rats, for at least 90 minutes, which was considerably longer than comparable impairment by tobacco secondhand smoke. So yes, the answer is that absolutely secondhand smoke can be effective. Another one that I wanted to put in there, because I do a lot of work with people who are suicidal and who struggle with suicide, and at the last ADHD conference I talked about ADHD and suicide, is cannabis use associated with suicide among individuals with ADHD? ADHD individuals have 2 to 4 times the risk of suicide in general, which is very important to keep in mind. And what studies have shown when they look at marijuana as a variable in there is it definitely increases that risk. Now, there are many different reasons for that. Certainly people who might be smoking marijuana chronically most likely are exhibiting an underlying mood or an anxiety disorder, which is also going to increase their risk for suicide. But there have been studies that have found that cannabis use and chronic cannabis use can uniquely contribute to elevating suicide risk. And that makes sense when we know the neurological impact for a young brain of that emotional dysregulation, of the impairment in executive function. So even now when you take somebody who's depressed, but take somebody who's depressed who's a chronic marijuana user, who now any problem-solving skills or any way that they might seek out coping mechanisms is now impaired because of their marijuana use, it makes sense that, and reduced impulse control, where there's an aspect of suicidality in people with ADHD that makes them at higher risk because there's a higher risk, higher impulsivity in people with ADHD. So I'm not going to say, you smoke cannabis, you yourself are going to be at higher risk for suicide, but we do know that the data is showing that it can uniquely contribute, even when we control. There are some studies that even when they control for an underlying mental health disorder like depression or anxiety, that cannabis use alone finds that people who are more chronic smokers are more likely to experience depression after the cannabis use. Not even, these are for people who did not have depression prior to chronic cannabis use. Increased suicidal thoughts and suicide attempts. So it's just, and the same results have not found the same risk for anxiety. They find that the risk is more for depression and mood disorders with cannabis use as opposed to the development of an anxiety disorder. So something else just to kind of please for people to be aware of, especially young people, that it doesn't help. So those are the questions we have, and then I know we only have about 10 minutes for other questions that people have.
And there's a whole nother set of questions, so I'll get right to them. That was great. That really was a fantastic presentation. Many, many insights. One is a lot of questions about a teen. How do you know, this is from a parent about their teen, how do you know when it's bad enough to get professional help? What are the signs of addiction?
It's a good question. So I tend to lean on the side of getting help sooner rather than later, because if it, is just quote unquote, just experimentation, recreational, and you seek, some help and consultation, it's like, okay, when you find out that this sort of is done and over with, no harm, done. But whereas the other option is if someone seeks help when somebody is really in it, it could be, harder to sort of get themselves out of it. But in terms of like signs of what the clinical signs of dependence would be when somebody is using a substance often, and often then, now it's often defined as often more than they sort of intend to. However, we have to keep in mind that with cannabis, some of the people say, no, I intend to smoke every day, so I'm not an addict. But it's more that when it starts to impair their functioning, when they feel they have to do it, certainly when you start to see people who are using it for, they're going to school high, they're working, they're getting themselves in situations that are sort of compromised, like driving, watching young children if they're babysitting high and things like that. They're spending, a lot of their money and doing it. Certainly if they're stealing so that they can get money to do it. But with all of these things, it's not if they fulfill 4 out of 7 criteria, it's really going back to that first question is, what does this do for you? Now, there are some patients that I work with who, they may use cannabis with a group of friends once or twice a month. I would not call that somebody who's dependent or addicted. I wouldn't say that that's healthy for them either or good for them, but I wouldn't put it on the same clinical radar. Now, when a lot of times actually with patients who themselves will say, I think this is becoming a problem, when they come to me and say that is when they say, I'm starting to do this by myself now, as opposed to it being just this kind of fun thing with friends. I'm wondering, or I'm finding that I'm doing this every night to go to sleep. Then you start sort of thinking, okay, now we're medicating something, and that's when it starts to become more serious.
Mm-hmm. Are there any studies or evidence that cannabis use causes ADHD? Because several people have asked. I just want to address that.
No. I mean, how we would think of ADHD is a largely genetic issue. Like, we're basically born with it. I mean, I often make the joke that, my son who has ADHD, we knew prenatally, when he was in the womb, that he had ADHD. So we are born with ADHD, and it's that cannabis will definitely be more appealing to an ADHD brain. Now, there are people who don't have ADHD who will use cannabis, and they can definitely develop symptoms that mimic ADHD in terms of all of those things I mentioned, of decreasing executive function, of lack of focus. Absolutely, all of those things can happen. But I wouldn't say that they have ADHD. I would say that the cannabis is impairing their memory and so forth, because what we don't know is, like, a stimulant, for example, my feeling would say would not be helpful for someone who does not have ADHD prior to the cannabis use. But because of cannabis use, they're having all these symptoms of ADHD. We wouldn't treat that with a stimulant medication because now we're giving them basically another substance for someone who doesn't really have ADHD, but they have symptoms that mimic it.
Right. This is a good question. You might have addressed it. Can you be chemically addicted to cannabis or just addicted to how it makes you feel?
Both. So definitely, from decades ago, people would say, well, you can't be, chemically, physically addicted to it. It's more of a psychological addiction. And that absolutely is, true and remains, true, where people, will say that they love the feeling of it. Now, though, what with research and with the current THC levels, which have quadrupled in, over the years. Like, again, as I mentioned in part one of the webinar, the cannabis that people are using now is not the levels of THC that people were doing in the 60s, 70s, or even early 80s. I mean, or even early 90s for that matter. So now, yes, 9% of adults who are regular cannabis users are physiologically, chemically addicted to it. 18% of people under the age of 25 who are regular cannabis users are physically, chemically addicted to it. So I remember years ago when I would have patients who I felt were physically addicted to it, but they were like, you can't be. And they would almost feel a sense of shame going to marijuana support groups because they're like, oh, I'm not a real drug addict, because of, this is not like a real thing. Well, we're seeing a lot more Marijuana Anonymous, a lot more of these support groups, which is great that they're out there for people. But part of why we're seeing more of it is because we're seeing higher rates of this physiological dependence. I have seen what people who are trying to quit this substance, and it is not a pretty picture. I mean, it's not just that they're psychologically irritated. Their bodies go in chills, they have sweats, they have all medical withdrawal symptoms.
Just one last quick one, because I think this is important. You mentioned emotional dysregulation with cannabis use. Can it be reversed if one stops smoking, the emotional dysregulation?
Yes. So the good news is that if somebody is, that there's a certain amount, well, this is how I guess I would say it, is that I'll start, I guess, with the bad news or the pessimistic picture is the earlier someone does it, the more frequently they do it, the higher the THC they're doing it, they could get to a point where it's irreversible, the impact. So if you think about it as like an injury, like a physical injury. So if a car rams into your legs, there is a possibility that you will be paralyzed and you will never be able to walk again. Now, for a lot of people, and what's great about the young brain is that young brains are also very resilient. And so even with people I've worked with who smoke a lot or use a lot of cannabis, even when they're young, when they stop and they're clear and clean, it absolutely goes back and they could resume sort of normal, healthy brain functioning because their brain is still developing. And so I always say it with this, caution of like, we have to be aware that the more you're doing this, you're increasing the chances that this could be irreversible. And I have worked with people who are now in their mid to late 20s who started using when they were 14, 15, who have not stopped. And, it is without a doubt done permanent neurological damage. And at the same time, I've worked with people who you would wonder, oh my gosh, like, are they going to recover from this? And then when they become sober, oh my gosh, it's like night and day in terms of what they can do and their ability to regulate emotions, their executive functioning and things like that. So the young brain is incredibly resilient and incredibly vulnerable at the same time. So it's this interesting paradox.
Yeah. Well, I think the hour's up. That was great. Great insights and advice as well. I appreciate you being here, Roberto. It educated all of us. So
absolutely.
And thanks to all. Yes, we'll have to have you back. Maybe we need a part 3.
Maybe.
And thanks to all of the attendees who are listening in. Hope you will join us on April 9th when we'll do a webinar on sensory processing disorder and ADHD. Thanks, everybody, and have a great day.
For more Attitude podcasts and information on living well with attention deficit, visit attitudemag.com. That's ADDITUDEMAG.com. That's ADDITUDEMAG.com. That's ADDITUDEMAG.com.